I asked you to develop this, which you can tell what that does. It's a more blunt end, and then it's really worked well, and that enlarges the size of the incision, goes through the capsule. And I use it both for knee scopes as well as shoulder scopes. The other thing that I've found is that this gives you a very good feel when it's going inside the knee as to where your capsule is. And I know that there's some guys in California doing the same thing. I injected with 60 cc's of saline to expand the capsule. That way, when I went in with this, the capsule didn't, and the synovium didn't follow as I went in. I have found with the Verirod, I don't have to use this anymore. So, I'll show you how I do this. Again, I do it sitting. You go in laterally. My landmarks are underneath the patella, the inferior pole of the patella. I go laterally to the edge of the patellar ligament or patellar tendon. And then I just go a little farther lateral to make sure that I'm at the joint line. I use some lidocaine with epinephrine. I go right where I anticipate the joint line is. And this way I know if I'm too low or too high. This one I think I'm a little bit too low. I'm going to go up a little bit more, come in a little bit, and that feels pretty good. So I'm going to come back and I inject the soft tissues with this. And then I use an 11 blade, and I use it vertically. I do not close my incisions, and this feels very nicely. So again, I'm keeping my landmark in my hand. I make an incision, not too big, and you did a good job, Ted, of the handle. So now I push it in, and I'm pushing it into the notch, is where I'm pushing it. So it's in the notch. I can feel that go through. That's a really very tactile. I can feel it, that I'm in. I know I'm in. Then what I do is, because of the problem I was having with patella, now he's got a little bit of a flexion contracture, so I'm going to go, but then I go underneath the kneecap, so I know that I'm under the patella as well. So again, before I used to inject with 60 cc's. Now I can go in with my trocar, cannulated trocar with the Cannuflow. I just gently follow in. I don't have to push hard. I've got the angle. I know which way I'm going. Goes in. There's no resistance. Again, I like to go up underneath the kneecap. Again, no resistance whatsoever. And that makes a big difference. It's got a little effusion. That makes a big difference with it. As far as, any potential damage, that type of thing. This is the shoulder now, and again, I use the rod for the shoulder as well. My portals, because I know some of this stuff you know, some of you don't, but I've outlined the acromion here. This is the AC joint, the corticoid process. And so in a similar fashion, although I don't always inject, in a similar fashion, I mark the soft spot, which is right in here, and make a small incision. Again, in the shoulder, I even make almost a smaller one. I use an 11 blade. And then I use the rod. And again, one of the things I like about it is the texture. It's much bigger. It's not as sharp. So you're following the anatomy so much better. So again, my corticoid process, I want to head towards that. Pop that through. You'll feel it. You can feel everything through there. I'm going to pop that through. I've already popped it. Actually, that's how good it feels. Again, if you have the other one that's sharp, I don't feel comfortable moving around. There we go, boom. So now I'm through the capsule. I don't have to infuse saline in that. So I'm through the capsule, and I pull out the rod. I've got the way that I went in. Again, now this has already been, that's the leading edge. Oh, it just goes much nicer, just right in. You just feel that go right in. So that's the way I use the shoulder. And I don't always use it on my lateral portal.